You sit here. Sit in the chair. First, from the first step, I will tell you. See, the patient is here. Okay. So first step before going to treat the patient, I will say, Assalamu alaikum. Good morning. I'm Radhakrishnan. I'm physiotherapist going to treat you. So you have some, you have little back pain. So I will give you traction treatment for you. Be relaxed. It is a simple exercise. You will feel more comfortable. I will get back to you after arranging the mission. Just a minute. You inform him, then you'll go. First arrange the things. Then you have to, because you should not ask the patient to come, then rotate him like, no, don't disturb the patient. First, that is very important. So first, arranging the mission. So now, this is thoracic belt. Right. This is for thoracic stabilization. Next thing is for pelvis. This is called as pelvic belt. So this belt is for pelvis. Clear? Okay. Now, we should not use any pillow while giving traction because the spine should be straight. So I will give just a head support with a towel so that he will feel comfortable. That's all. I'll keep a towel for head support. That's all. Sir, please come. You will ask the patient to come. Sir, please lie down. You should give instruction. Please lie down. Yeah. Come down a little. Your pelvic should be here. Pelvic should be in this level. Yeah. Okay. Little bit also. Little bit pelvic should be in this level. Yeah. Okay. Lie down. Yeah, lie down. Thank you, sir. What happened? He's lying down like this. Okay, so this is thoracic belt. Now I'll ask him, you breathe freely, sir. Breathe freely. I'll put a belt here. So this stabilize. Don't put it very tight. Don't put it too much loose also. It should be correct fitting. Ask him to breathe freely. Are you comfortable? Yes. It's too tight? No. Very good. So it should not be very tight. It should not be loose also. It should fix one. First step. Next, now I am going to apply the pelvic belt. Pelvic belt, see. Now, before applying this, you should check the rope is in the center. See this? Come here. This should be in the center. Pubic symphysis should be in the center. Should be in the center. Now it is center, in the center exactly. So now I will same way. This should be firm. If you put the belt in a loose manner, no use. It should not be very tight, it should not be loose also. Only when it is properly fixed to the skin only, you can get a very good traction. If you have applied loose, what is the use? No. You will not get any pull, right? So you will put this, now this is clear. Okay, now what I will do, I will ask the patient to slightly flex the hip and knee. Why? Why flexing hip and knee? Always flexing the hip and knee will relax the lordosis. Relaxing of the lordosis, lumbar lordosis. So you can get a relaxed lordosis and no strain to the back while giving traction force. Now clear? Okay. See, now I am connecting, pulling this. This should be straight to the pubic symphysis. Focus this. This is called as pulley, fulcrum, right? This pulleys should be straight to the pubic symphysis always. Now I am connecting this rope. Connected. Clear? Yes. This is intention. Now come here. Now, sir, be comfortable. You will feel a slight pulling force. You will feel a slight pulling force. Please be comfortable. If you have any discomfort, please inform me. Now, I will give the emergency switch to the patient. See, this is called as a protective switch. If the patient feel any discomfort, any pain, he can press this. So what happened? Automatically the equipments get switched off, so the treatment stops. Sir, this is an emergency switch for you. If you feel any discomfort, any pain or more traction, you can just switch off the machine.
Doctor,
yes.
You said we that according to patient weight.
Body weight.
Yeah.
Yeah, we have not fixed anything. I have just on now we have to go and set the timing and parameters. Okay, now come here. Now I've switched on the equipment. First point what we have to fix is always is the treatment time. This is the time. How much time you want to give the traction. Generally we will give traction up to 20 minutes. Okay, if 20 minutes. If it is a very chronic condition, chronic means for long duration, more than 3 weeks, 4 weeks, right? It's a chronic condition. If it is a chronic condition, if it is a chronic condition, we can increase the traction up to 30 minutes. So now this is it's not a very chronic condition, so I will keep the as 20 minutes. Okay, this button is to adjust. If you want to increase the timing, see upward arrow, 1, 2, 3, 4. You want to increase the time. If you want to decrease the time, maximum it will be up to 1 hour here, but we don't want that and all. Okay, so now I'm keeping for 20. Class, clear? Now I fixed the time. Next point is the traction force. How much of kg force I am going to use for this patient? That is the next option. So how much of force I should keep is always with the patient we have to use, there is a formula, 1/3 of the body weight. 1/3 of the body weight. For example, if the patient is 75 kgs, 75 means Kamsa Sabine.
Yes.
Correct?
Yes.
Kamsa Sabine. So if it is 75, then you will give only 1/3 of that. So 1/3 means Kamsa Shreen, 25 kgs. Clear? Okay, so if 75, then you will give only 25 kgs. If it is 60, then it's only 20. Think that he will be approximately 60 kgs. He'll be 58 to 60. Am I right? 60. So he's he's a 60 kg gentleman. So if it is a 60 kg gentleman, then our option will be for 20. So now we have to give 20 kgs of force. So this 20 kgs whole force we have to fix now. See, whole force 20 kgs. See, in this option we have both kg and pounds. The inner circle is kg, outer circle is pounds. So now I am going to keep in kg. See, from 0, this is 0. Slowly you can see I am slowly increasing the traction force. See, this inner, I should see, slowly I am increasing up to
20.
Yeah, 20. Clear? Now I fixed 20 kgs. Outside is pounds. Now you don't confuse yourself. You just think about the kgs. So this is for K. Now I have kept 20 kgs. The whole traction force will be 20 kgs fixed. Now we have another thing, that is the rest force and the hold force. Okay, rest force means hold force I have fixed 20 kgs. That is how much of pull there will be there. Rest, at rest time, because one time it will pull and one time it will relax. One time it will pull, one time. So during pull it will be 20 kgs. Rest time how much you want? It depends. Generally we will keep 0 because rest should be totally in a relaxed position. Again stretch, relax. But if it is acute condition, you can't totally relax because patient will get pain. That time we'll keep some 5 kgs or anything. Now for him I keep 0. Okay, this 0. The rest force is 0. And hold force is 20. What is the meaning? The hold force means when it pulls and it maintains for 20 kgs. When in relax, no force, 0. Okay. Now next point is rest seconds and hold seconds. How long you want to keep the force and how you want to relax. It is a intermittent, not continuous traction, intermittent traction. So if I want to just pull for 15 seconds and rest for 5 seconds. 15 seconds, rest seconds. So what I will do, first I will keep for hold second. Hold seconds, always mostly 15 seconds is good. Any we'll know no stretching and all. We'll give for 15 seconds. So samely, we'll hold for 15 seconds and rest for 5 seconds. You can adjust. If you want to less, 2. Or if you want to increase, 5 seconds. So this is for rest and this is for hold. Clear? So everything now we have set. Speed. Speed is in which speed you have to, we'll keep always speed in minimum, because you should not give any sprain or anything. Very, very important. We'll keep it in minimum. Now what I will do, everything now it is set. Now you tell me what all the parameters we have set. For this patient, since he is 60 kgs old, we have given a traction force of 20 kgs. Clear? Now, then, so for 20 minutes, there will be 20 kgs of the force, and for 15 seconds, there will be a pulling, and for 5 seconds, there will be a relaxation. Clear? Now, everything is, so now I am going to start the treatment. Start. This button is there, so start. We'll ask the patient, be relaxed, sir. You will feel a pulling force. Now you can see there is a pulling force in this. Slowly, can you see? Slowly the pulley is moving. See here, you can see the movement. So this is pulling. So you can see the traction force will come till 20. Okay, now it is 20. See the pull timing, it's going descending. So once 0, again it will go for rest. Now it is in the pull stage. 3, 2, 1, 0. Now rest. Rest for how many seconds? 5 seconds. So now it is releasing. So rest will be there for 5 seconds. 1, 4, 3, 2, 1, 0. Kalas. Now again pull. How you feel? Quiz. Clear? This is a method of applying traction called electronic traction. Okay. In biomechanics, you would have studied about the traction force. Right? All you would have studied about only the force. Traction force. Can I switch off now? Okay. Thank you. Now we should teach him. Who will teach Hassan and Uzain? Only then it will be easy. Everything then I will. Okay. Somebody should teach him now for some 5 kgs, 10 kgs of the weight. Tie it to this rope. Kalas. If it is that, then it is called as mechanical traction. We have 2 types of traction. One is mechanical, another one is electronic. If you are using the machine for traction, then that is called as electronic traction. Because this is an electronic machine. Electronic traction. The same thing, if you are connecting the rope to a weight of 5 kgs, 10 kgs, just tie and put it down. Then that is called as mechanical traction. Okay, mechanical traction generally we will give in the bedside traction and all. When the patient is admitted in the hospital in the bedside, then we will give. Now